That's why it takes as long as it does. You see, once the bug gets in, if you don't do anything about it, it'll take a week for your system to cure it. So once you recognize you got a bug and you go see the physician, he gives you some medication, you can get rid of it in 7 days. Okay. This is under normal, ordinary circumstances. But everything is ordinary and normal. When the system gets broken down, stressful, nothing works just right. So I say to people, if I have a cancer patient I'm working with, when did you first find out you had this problem? They tell me, and I'll say, what happened 18 months before that? When did you get stressed out? What happened that upset you so much? And they'll think back and say, they had an event, or several events, or they live in a situation where they're always stressful. The system is always broken down. Got a neighbor I found out from his wife 2 days ago, just before I left. She came over and she said, Mike, Keith has got prostate cancer. And they found a big tumor in his brain and all through his whole body. He doesn't know what he did in the morning and doesn't remember me. The doctor says, maybe a week, maybe 2, maybe a month. Married 42 or 47 years, something like that. And I know Keith. When he gets angry, he gets vicious. You bet. Beyond control. Been that way all his life. That's his problem. His system has been shot for years, and now he has the result of it. So this is what happens when the whole thing goes bananas. All right. What's your job? What runs the system, basically? The brain. The brain runs it. The brain runs, rules, and controls every cell in your body. Every cell. Every day of your life, you build 1 billion, that's with a B, 1 billion new immune system cells. Every day. And every day, you lose about just as many. You have in your body 4 days' supply of immune system cells. That's all. 4 days. So understand all these cells are changing. Like other cells in your body are changing. But you see, you got something here identifies something new. When a cell dies and a new one is there, it's programmed with the information that's been in the system all these years. So they talk to one another. They teach one another. Helper T cell, suppressor T cell, 2 to 1. HIV, the virus that causes AIDS, only attacks the helper T cell. That's all it does. And by attacking the helper T cell, it alters the ratio between the helper T cell and the suppressor T cell. So the ratio can be changed from 2 to 1 to 1 to 6, or 1 to 12, or 1 to 100. Now what we got? We got more suppressor T cells telling the system, ain't a god darn thing wrong with you, and we don't need the backup system. While the backup system is playing poker, smoking cigars and drinking their beer, the body's been destroyed by cancer, infections, and you name it. That's right. Strange as it is. So what are we going to do about it? So you got two problems primarily. The system isn't working by stress or messed up because of the change in the ratio, or when we're stressed out, we have a cell that we build. We're always changing our body. Every day we're building new cells, and because we're not perfect, we don't build every cell, every new cell, as a perfect cell. Some of the cells are mutated, they're confused, they're diseased, and when they come out into the system, the primary system attacks your cells, your body cells that aren't right. And the cells that you build, they know they're going to be destroyed because they have intelligence, and they run and hide. They try to get away. And if the system is stressed out and not efficient, the cells that you build that should be destroyed, they bore into another good cell. And they take the inside of that cell to survive. And then they suck the energy from the adjoining cells. And they start to destroy all of the other cells. And they begin to multiply and grow. And if the system is broken down, a tumor may develop. The exterior of the tumor is made of good tissue. And then as these cells finally get a little more active, they go past this tumor and they say, oh, been here for a while. Leave it alone. And the tumor continues to grow, and maybe someplace, somehow, a piece breaks off, and it travels and it metastasizes to another place. And the guy says, well, over there he's okay, and over here it's got to be okay. And so it goes, and it goes, and it goes, and it spreads. Nothing is done about it. Your system says it's okay, it's been around for a while. The exterior of the tumor or the cancer cell, the first one they get into, becomes hard, like an eggshell. Looks the same though. So now we got to do something about this. So we have to get the immune system cells to understand we got a problem and go and fight it. Okay, let's get back to yesterday and the day before. When I tell the brain in a state of hypnosis that we have a problem, you can't say the body is healthy and make it healthy. You can say the body doesn't have any stress. The body is joyful and happy. We're talking with something that does not exist in your body in essence or being. We're talking about emotions and symptoms. We get rid of the emotions and symptoms by putting in the good emotions and symptoms. You can't fix the body by saying this body is healthy. Because if you say this body is healthy, you're just making it worse. You're sending the wrong message. You have to say, brain, we have a problem. And you find out from the physician or the people that do the testing and so forth where their problem is located. We have a problem. Get busy. Search and find, or search and locate and find and destroy and remove the residue. Take the residue onto the stool and the urine and get rid of it. Pass it through. You have to understand when the doctor says, "Would you give me a specimen?" What he's looking for is the residue of what's been destroyed. He says, "Hey, you know what you got in your body? You got this or this or this." That's how you get rid of it. So now we got to get rid of this stuff. All right. So far, on this, you got any questions? Yes?
How do you get specific enough to tell the brain?
Well, you're ahead of me.
Okay.
On this that I talked about so far. Do we all understand what we're talking about? The immune system, the two setup, how they talk to one another, biochemical substances. All right? This biochemical substance, they have a lot of different names. Don't worry about the names. Don't worry about how many cells we have. I just want you to understand and know that it works this way. I told you before, you know, don't tell the brain how to do it. You tell the brain what to do. What to do.
You have to tell where to do it.
Yeah, we'll get that. So you tell the person in a state of hypnosis, you got a problem, brain, in this body, and you haven't taken care of it, and you're the boss, you run every cell in this body, so why don't you get your ass in gear? That's right. Let's get things going here. Pardon the expression. How do we do this? I have an article that appeared in the Phoenix paper, I think in probably last February or a while back. Discoveries put AIDS expert on a new track. Many pieces of the puzzle remain obscure. Many details of the process are hotly disputed. And many scientists like Fauci are far more guarded in their optimism about other people, Fox and some. But if a recent meeting of 500 AIDS scientists from around the world, it was clear that researchers separated by seas and languages are reaching new and striking similar conclusions about the way HIV works and about the possible new direction for treatment. Now the scientists are getting smart. And then it goes through here, and I don't want to read the whole thing, but it says in here that they believe that the immune system, its deficiency, is destroying its own body. They know that the helper T cell is the one that's being destroyed. They know this is a matter of course, and they've known it for years. But if the immune system's self-destruction does turn out to be the key to AIDS, it seems logical that a severe jolt to to the immune system early in HIV infection might be the system, might set the system back on a proper course before the opportunistic first infections occur, many scientists now say. So they're saying, let's give this system a jolt. And that's what you're going to do. You see, I've been doing it for years. And now all these smart guys who don't think hypnosis is worth a tinker's damn, beginning to understand that maybe there's something to this, but they don't know how to jolt the immune system. They're locked up in their own books, their own program, their own education. You come in with a side thing, say, that's a lot of baloney. And like years and years ago, you see, medical profession, they turned their nose up on the chiropractors. And now they say, yeah, it has a proper place as a modality for treatment. And for years they say, hypnotists, well, they don't know what they're talking about, because you see, you put a person into a trance, or you send them into the unconscious state, and we haven't put our act together. So we better get our act together and be uniform in our language so people understand that you are a professional and you have a science that you're going to utilize. And I'm going to show you how you can give this immune system a jolt and put the body back in balance. So let's take a little break and get back in about 15 minutes.
Mary, she came.
Pardon?
Let me introduce you to Mary. She came. She's in the back.
She's back there. Okay. All right. Now the big question always comes up, does it work? Does it work? I hear you're talking, but does it work? I told you the other day about Joe Reynolds. Had 3 weeks to live, cured it. Randy Steuven came to see me recently. Went to Mayo Clinic in Scottsdale, Arizona. Mayo Clinic has a big place there. Matter of fact, it's almost as big as, well, no, they got one big one in Rochester, Minnesota, and that's a 9-story building, I think now. When I was there, it was like 4 stories. They just kept getting bigger and bigger. Mayo owns about half of downtown Rochester. They own some of the hotels, the Kaler, and I think something else. And they got tunnels under the hotel to their clinic. But Arizona is a nice place for retirement, and our death rate is pretty good. A lot of people die from a lot of different things, so Mayo decided, let's come to where the people are. And they built a big clinic in Scottsdale, and now they're just tripling the size of it. But Randy came from Mayo Clinic, and they told him inoperable cancerous brain tumor, and they couldn't touch it. Because in order to operate, it would destroy too much of the brain. They do more harm than good. And they said, well, that's okay. It's a slow-growing tumor. So Randy heard about me, and he came in to see me, and I explained exactly what I did here. You have to educate your patients, your people that come to see you. I have a chalkboard, And I explained at the beginning how the brain works and how the conscious and subconscious mind feeds, and they go through the whole process. And I say, when you're hypnotized, I'm going to give you some suggestions. When my thought or my suggestion is a false statement becomes true, then you're ready for therapy. And they won't be able to lift their leg. They can't talk. They can't get out of the chair. You say, you've been hypnotized? They'll say, heck no. You see, their perception of hypnosis is they have to be in a trance. They have to be unconscious. And you straighten them out. Then I explain about the immune system. And they all say, you know, you make it sound so easy. Everybody else is using chemical and medical terms. Make it simple. So you got it here nice and easy. Got a tape back there on the immune system. And it's on testing. So do what you want with those tapes. Well, anyway, Randy came to see me. And inside of 60 days, his cancerous inoperable brain tumor totally gone. Absolutely. But he wasn't doing so good. You see, his doctor says, I don't know when it's going to come back. What caused it in the first place, we don't know. And what'll make it come back, we don't know. Well, Randy wasn't feeling so good. He came in one day and he sat on the couch and I said, Randy, I said, if I had your problem that's gone, I'd be jumping to high heaven, screaming and hollering how nice it is. And you're dragging your butt. What's wrong? He says, well, I don't know, my arm isn't working just right. My leg isn't working just right. He said, I'm taking therapy. I said, what kind of therapy? He says, physical therapy. I said, when did you injure your arm? He says, I didn't. Then what's the therapy for? Well, the doctor said I should have therapy. Okay. I said, Randy, you got another problem. Both of your arms you can't move. Look at them. As you think about lifting your arms, your thought causes both arms to go totally numb and completely useless. I looked at his arms and he couldn't budge either one of them. You see, I knew Randy was in hypnosis and had been there since he found out about the cancerous brain tumor. His stress pushed him there. I said, Randy, you better go back and get physical therapy for both arms. I said, but let me show you how we can take care of that. I clap my hands, both hands perfect, and I'm going to lift them up. We lift them up. I said, see how fast I do the therapy? Got him back in the chair, put my hand above his forehead. I said, Randy, you try to keep your eyelids open. There's no way you can. He looked at my hand, and bingo, he was gone that fast. I said, still remaining pleasant and relaxed, Randy? I said, open your eyes. I flipped the chair back up again. I says, there's no way you can get out of this chair. But think about it. Think about it. For as you think about getting out of the chair, your very thoughts cause your leg to become numb, hinder heavy, arms useless, and suction cups holding you against the chair. But think about getting out of the chair and you find you can't. So direct your attention to it. I just keep prodding, you see. Every time I say, think about it, just make it worse for him. And he couldn't get out of the chair. I said, you better go back and get physical therapy for your whole body, too. I said, Randy, the next time you go see your physician, your neurologist, I want to go with you. So we did. Walked in there and introduced myself to him. And he was sitting on a small little chair that has the kind of twist you turn, up or down. Randy's sitting on the examining table, and I'm standing over here. Randy's wife is sitting on the chair. And Dr. Feinstein comes up with his little metal hammer with the rubber end on it. He's going to test the reflexes. And he hit him on the knee, and the leg bounced, the other knee bounced, the arms bounced. He said, Randy, your reflexes are pretty good. I said, Dr. Feinstein, do you have the x-rays available for Randy's head? He said, yeah. And I said, can we go and look at me? So you read x-rays? I said, oh, fairly well. So we walked down the hallway. You got 6 sets of viewers on the hallway and put 6 sets of tapes there. Here's the brain tumor, gone, got a space, getting filled up with fluid. Oh, I said, why the hell don't you tell Randy that you got a space there filling up with fluid and you got a cyst there now? He said, well, why should I tell Randy? He doesn't know how to handle it. Okay. Went back in, And I said to him, what are you going to do about the fluid? So he wrote out a prescription. Tore it off. He says, Randy, here's the prescription. I said, what's it for, Dr. Feinstein? He said, it's so we can dry up the fluid. And he says to Randy, if it doesn't work, call me back. And he says, I'll put a new one out.
Yeah.
I said, Dr. Feinstein, tear it up. Ain't any damn good. He said, well, how do you know? I said, you just told me it wasn't any good. He said, I didn't say that. I said, oh, yes, you did. That's the impression I got. That was his interpretation, too, I believed. He said, well, what makes you think it isn't going to work? I said, you told him. Because everything you've been telling Randy, as long as you've been treating him, whether it's false or true, it's all true. He said, I don't understand that. I said, okay. Do you think Randy's got good reflexes? And he said, yeah. I said, you're wrong. He doesn't have any. He said, but you saw it. I said, that was then, but not now. Well, he says, I'll show you. And he gets a little mallet and walks up again. He says, wait a while. I said, Randy, when he touches you on your shin or any place in your body, with that, when he touches you, it causes that place to become totally useless, like rock. It doesn't have any reflexes. Feinstein hit him and hit him and hit him, and nothing happened. I said, you see, I told you I didn't have any. He said, what the hell did you do? I said, I took it away. I gave him a false tape, and my false tape become true. That's what you've been doing. He said, well, gosh, he says, what's going on here? I said, you want the reflexes back again? He said, yeah. I said, okay, they're back, Randy. And he went back, and sure enough, they worked. He said, amazing. I don't understand this. He said, well, then if we can't drain it or can't dry it up, he said, then we got to put a shunt in there. We got to drain it. I said, no way. We'll drain it. He said, how you going to do that? I said, we'll take care of it. No, he said, you better go see Dr. Brown. He's going to put a shunt in there and drain it out. This is on Thursday. I said, well, Randy's leaving today, or leaving on Saturday. He's going to Minneapolis. So I said, why don't we work about it, do it later on? So on Friday, I made a tape for Randy, took it to his house. Saturday, he left to Minneapolis. Tuesday morning, 7 o'clock in the morning, I got a call from Randy's wife. She said, Randy drained the tumor, or drained the cyst last night. I said, how does he know? He said, he felt it had been drained, his arm and legs perfectly normal, everything's fine. What did I do? The tape says, hey, Brian, we got a problem. We got some fluid in there, and we have to get rid of it. So you tell those immune system cells to kind of push those neurons aside and make a channel so the fluid can drain through. That's what it did. Drained it right out. Too simple. Too easy. You got to go and operate and put in a drain, because that's the only way they do it. So understand, if we can do all these things by suggestion, no limitations. But you have to tell the brain what to do. You got a problem. Don't tell it how to do it, what to do. So we're going to have people come up here this afternoon, and we're going to do the induction, the progressive relaxation, a couple of deepening techniques into the library. Those who can't go to the library, I told you yesterday, you're taking them back into the classroom or taking them back someplace, and you have them select any place they want to go. Any place. Any place that they want to go where they're comfortable, alone with their thoughts. I had to walk along the beach, and I says, anything on that beach that doesn't belong there, that's a problem? She said, yeah. I said, what's there? She says, there's some old sticks. Fine. Reach down and pick up a stick and hold it in your hand. When you got it, nod your head, yes. Okay. Let's give this stick a different identity. Let's call this stick your desire for a cigarette. You take your desire. See, once you make the conversion, you keep it that way. Don't ever call it a stick again. You take your desire up there, up high on the beach, and you put your desire on the sand, and you get on your hands and knees. With your hands, you dig a hole in the sand. Take your desire, put your desire in the hole, and cover your desire and bury your desire. It's gone. Go back down again, look around, you might find a rock that doesn't look good. Hold it in your hand. That's your anger or your hate. You reach back and you throw your anger and your hate out into the water and watch your hate sink and disappear. It never can come back up again. Totally gone. Use anything in the circumstances that you can get rid of. Then I says to this girl, I says, okay, you sit there on that nice sand and you build yourself a little mound of dirt between your legs, nice and easy. We'll call that a castle. And your castle should have windows and doors. So with your finger, you poke the windows and make the doors. When you have the doors and windows in, just nod your head, yes, I have them. Fine, okay. Now you see a castle has occupants. And your immune system cells that got mad at you and they decided to leave, they're in your castle. So I'm going to count up to 16 or whatever it may be, snap my fingers, and your immune system cells that have been disgusted with you, they come sneaking out of the castle when I count. Out of the windows and out of the doors. And onto your body, and then they sneak into your body to the tiny pores in your skin. The holes in your body. And she's sitting there, her legs like this, you see. Just happened to have cervical cancer. I snapped my fingers and out they come, and guess where they went? And when they worked, they sure did. And inside of 30 days, she didn't have a problem anymore. So you can create a lot of scenarios, a lot of ideas, a lot of pictures, a lot of images. Be creative. When you have somebody coming in, think, how can I handle this? Think about it. And start making some notes for yourself so you don't get stumbled. If you get stumbled someplace, it's surprising I told you, your subconscious mind is going to find a way for you to get out of it. You'll find a solution. All right. But you have to tell that brain that we have a problem in the body. Don't say I'm healthy and I'm fine and it's all wonderful. That you use with the emotions. Physical thing. Most people can't separate the emotion from the physical thing. It's always hand in hand and they're tied together. So if you have a damage or a tear or a stab wound in your leg, you have to have pain. That's part of the physical thing. Pain is not part of the physical thing. Several years ago, I had a woman out in Scottsdale. In Scottsdale, they have a lot of golf courses, retirement area. Some 30,000 people out there. And she's driving her little golf cart down the street. Got involved in an accident and fractured her left ankle. They took her in Boswell Hospital. And they were going to operate and reduce the fracture in her ankle. And the doctor decided, well, we better call her attending physician and see if there's any additional problems. And the doctor says, no way. You can't give her a general anesthetic, you're going to kill her. They got this lady in a hallway, ready to go in the operating room. What are they going to do? And one doctor says, oh, he says, you know, the other day he saw us on TV. They did his dental surgery. I saw the clip. It was on the newscast. And he hypnotized this woman or this guy, and they did the dental surgery. Took away all the pain and stopped the bleeding. Why don't we call him and see what he can do? Well, I just happened to have an office I was part-time filling with on Thursdays, I guess it was. And they called me, and I'm just hop, skip, and a jump from the hospital. So I went in there. I hypnotized her in the hallway. Wheeled her into the operating room. Got her in there, and the doctor says, well, how do we know? I says, just let it work. Forget about it. Well, they're all sitting and waiting for to bring in the patient. So they put a bar across the table. They put a cloth over it. And she and I are on this side of the cloth, and we're talking, and she's describing her trips in Germany, how she's going through the Garnish Valley and she's doing all this and describing all the buildings, why the doctor's over there cutting her leg wide open. Then I knew he's going to have to do some drilling, drill through the bones. And I says to her, it won't be long now. I said, you hear the psh, like the wind as it goes through the valley. And sure enough, the old drill started. I said, you see the wind? Listen to the wind. She says, oh my God, I remember that. Used to go down the valley. She said, oh, that's, ooh, you could hear it. Eh? It was all over with. And this doctor kept peeking around the curtain, keep peeking around, and when is she going to scream? And we're laughing and talking about things, and he's back there busy drilling. Passed her all together, right from there, into her room. No recovery room, nothing, just non-intensive care, right in. Got all through, and he says, I got to talk to you. We went downstairs and had coffee, and he says, never seen anything like it. Man, he said, was I scared? I wanted her to, I figured she was going to scream and holler, and then what the hell am I going to do? See? Guess what? Never called me back. Never called me back. Well, the hospital didn't like it. Anesthesiologist didn't like it. You see, once you deviate from the standard of procedure, they'll say, ho, 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 we're open to litigation. That's right. So that's where you have the problem. But they're going to call you sometimes, an emergency case, and say, we need some help right away. This person is screaming and hollering about a needle. They can't take it. We can't help them. Would you come? And you go over there. And you do what I did here. Put the hand there, push it down, and boom. We went pretty deep in a hurry, didn't we? Who was here the first time? You remember? You? Who was the other one? Yeah. Two of them went, boom, totally relaxed. And all you got to do is create anesthesia by just saying, I touch, you see. How do you create it? Real easy. When you put a person into hypnosis, either in your office or in the hospital, and you can do this as a post-hypnotic suggestion. You can tell the person in hypnosis in your office that every touch in the area by the physician with a hand, with a glove, or with an instrument, by the physician, by the assistant, by a nurse, every touch on that area causes that area to become totally numb and useless. And each passing moment causes the area to go progressively more numb and totally useless. You take them in, the post-hypnotic suggestion, they get in there, and the doctor touches them, and the area becomes numb. You can give a suggestion that in the event of surgery, in the event that the blood is to be disturbed, the capillaries of the veins cut open, have your immune system seal and collapse those capillaries instantly. And after the surgery, when it's all done, to increase the healing process, to mend and repair any damaged tissues. Replace them with the good tissues, the young, strong, healthy, energetic ones. So you increase the healing process. So what you do, two things: you make it numb so they can go ahead and work, and you increase the healing. And I got news for you. I did this for a young lady. She went in because she had a operation on her lip. She had about 6 or 7 operations. And every time she had the surgery, she got the anesthetic, she became violently sick, heaved all over the place. And you know, plastic surgery tears apart that way. So I worked with her at her home, in my office. I saw her the morning of the surgery. I worked with her in the hospital. I walked with her to the surgery room, and goodbye, Beth. I'll see you in a few moments. She went in. 20 minutes, she came back out at 25. Took her up to the room. Opened her eyes a little later on. She looked at me. She says, "Hi, Mike." I said, "How are you, Beth?" She said, "Fine." "Could you get me some ice cream?" Went to the nurse's station, got ice cream, and I fed her. "No problem." Didn't have a bit of problem with the anesthetic. 2 years later, she and her sister had to go see the dentist. Her sister went in, and the dentist checked her, and he says, oh, you got a couple here, need to be filled. And he said, what should we do? She says, oh, put something in there. Put some Novocaine, anesthetize it. Beth went in there, and he said, how about you, Beth? And she said, well, I don't think so. And he just touched her with that instrument. And the whole thing turned absolutely numb. He said, are you sure you don't feel anything? She said, I don't feel a thing. Are you sure about this? She said, I don't. Well, he says, okay, if it hurts, let me know, and he said, I'll take care of it. And he went and he drilled it, and he filled it, not a bit of problem. And he couldn't understand why she didn't have any pain. 2 years later, my suggestions still continued to work. See? Yeah, all right. Time to call it quits. Be back, 11:30, 12, 1 o'clock, an hour and a half. All right? We'll see you then. And it's going to be a little more difficult to get a positive and complete result with all of these up here. So if I bypass some of them and eliminate some of them, is because by handling one other problem, we may be able to work on that one. You see, we talk about fear. We got fear of what? Fear of failure, fear of going outside, fear of driving over bridges, fear of public speaking, fear of swimming, the fear of water, fear of heart attacks, fear, fear, fear. If we handle fear, I'll say, all right, you think about your own individual problem as it relates to fear. So we may not cover all those little ones. Fear of going over bridges. Some of these things, let's kind of kick it around just a little bit. I worked with someone just the other day about driving over bridges and driving. You put a person in a state of hypnosis. You want to handle fear. Fear of bridges. So in a state of hypnosis, I say, you know what they did? They built that bridge just for you. All bridges are built for you. They're built with specific instructions. They built them the size they're supposed to be, enough energy that goes into it, enough structure goes into it, enough safety goes into it. They put on barricades, they put lines just for you. So other cars stay on their own side of the lines. And the sides are there, the barricades are there to make sure you and none of anybody else that uses your bridge gets off. So when you see a bridge, you say, yep, they built that for me. I wonder why everybody else is using my bridge. You see, they built it for you. It's your bridge, and they made it easy. You don't have to go 100 miles around somewhere else. They built the bridge just for you. So when they look at that bridge, you say, yeah, that's my bridge. It's okay if somebody else uses my bridge. If my bridge is destroyed, what are they going to do? They're going to fix my bridge. How are they going to fix it? Just for me, the way I like it. Nice and safe and everything else. And you know what they did? They built my car. So it's safe to go over my bridge. And they make it nice and easy. They put a comfortable seat there for me. And they put seat belts on. And all I got to do is touch that little pedal, and guess what happens? The car stops. I don't have any problem. If I want to go someplace, They put a little pedal, I step on the little pedal, and I go as fast and as far and as long as I want to. It's not a problem anymore. You see, their perception of a bridge is danger because somebody fell off of it. And since you've been driving a car, you're an expert at driving your car. Make them experts in everything that they do. See? So that's, it's not a problem. They built the bridge for you. The water is there because God decided we need water. He decided we need sunlight. He put the water there for you to use and to drink. It's always there for your purpose. And He made you so you could float on water. If you just got to lie down and that's it, you're going to float. Then they give you arms and legs. You just got to move them so you just go along. Why, swimming is the easiest thing in the whole world. You don't have to do anything. Matter of fact, you were born a swimmer because you were born in water. You see? Minimize their perception of a particular problem. I had a girl that was afraid of water. Couldn't fly over water, she went bananas. She flew to Hawaii, and for 10 days, she's in bed. Now she's going to have to fly to France. And she worked for some big company. She's in the purchasing department. How is she going to do it? Fly over there and stay in bed for the time? And I says to her, you know what? That water is for you and for everybody else. God made it. We need it. He put it there for us. I says, and when you get on that plane, you look out that window, you look down below, you know what? God had the sunlight. And the sunlight shines on that water and reflects. And guess what that sunlight does? As it reflects, it plays your favorite tune. And you do hear your music all the way across. Because you see, only plays your favorite tunes. Well, she flew across into France and looked outside, and all her favorite tunes are playing. The sunlight is dancing, bing, 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 and all she's doing is enjoying it. She got to France and did her work, and she and her husband went to southern France and spent a couple of days there, and she says, you know what I did? I actually got in the water and I swam. And they rented a boat for a while. Thoroughly enjoyed it. Was sick flying over it, never even touched it. Now she's back in the water. Her husband called me, he says, I think you're the greatest guy in the whole world. We sure enjoyed our vacation. See? You see, we look at things and say, well, you got a problem and it's difficult and I don't know if I can get rid of it. Minimize the problem, you minimize the emotion. All right, I have passed out this article. Everybody got one of these? So you picked it up or you passed it out. I have some more after a while. If you need some, I got some in here. All right. That article kind of gives you a little bit of background and some idea about how your body functions and how the people have identified different systems in your body. Use it. We're not going to discuss it. Background information, that's all. Read it and understand it. It's written in the article. It's written in a magazine. That my article that I passed out for you on why hypnosis works. That was published in the same magazine in 1989. And when that article was published in the magazine, I probably got 150 calls. And somebody says, finally somebody decided what hypnosis is and why and how it works. And the people that read the magazine, the people that belong to that association, are professionals. They have a degree from an accredited university, either MDs, PhDs, DOs, psychologists, psychiatrists, and so on. And it's amazing how few of them understand what I was talking about. They go back into the same old program. So difficult and so hard to get a hypnotist, whether it's a psychologist, psychiatrist, or anybody else, to change their way of doing things. And that's why I say, you're going to have a problem changing your language. I say don't use the word will, and you make your own tapes, and I'll tell you what, you're going to hear that word will over and over again. And I say don't use the word it, those, and thens, and it's going to be in your tape over and over again. So you stand up next to a chair, you put a doll in there or a dog or something, and you do the steps. You do the induction, bring the hand down, you do that over and over again until you got it pat. Then you do the progressive relaxation. Think about and relax it. Never say feel it's happening unless you create it. Go over it again and over again until finally you got it set in here. And then you do the counting backwards from 100. You do the classroom. Get them into the library. Step by step by step. They get it down pat. Don't use my words. Know what I'm doing with all the steps. Know what I expect to get from all the steps. Use your own language to achieve the same thing. Tell me, in counting backwards from 100, what is the deepening technique by design? Why do we do that?
Mental disorientation.
Pardon?
Mental disorientation.
No. What is a deepening technique by design?
Descending lower and lower.
Counting backwards.
To see how deep they are.
What do we do that for?
To deepen.
A deepening technique. But what in this is a deepening technique? What creates the... Yes?
Counting backwards causes you to be
Each decreasing number causes you to relax more and more. Come on now. And with each decreasing, you are relaxing. Counting backwards because each decreasing number causes you to relax. Then what do? We put in the disorientation. We send them over to their arms while they're counting backwards, and you mess up their thinking. And they start to get confused. And then they stop counting. What you've done is messed up that conscious awareness, and it says, I don't care for this anymore. I'm taken off. Okay? The blackboard in the schoolroom. What is the deepening technique by design? Why do we do it? What is the deepening technique?
Keeping their mind busy and they talk.
Who said that? Each movement of the eraser causes you to relax deeper and deeper, and with each movement of the eraser, you are relaxing deeper and deeper. That's the deepening technique by design in this setting. That's why we do it. Okay. What is a deepening technique through stress in that setting? What?
Confusion around the.
What do we do to confuse them?
Same time.
What?
You're doing two things. They're counting, they're writing and erasing, and you're then distracting. talking.
While they're writing and erasing, I'm talking about what? Yeah, I'm talking about the P's and Q's and R's and M's and D's and P's and everything else, and they get totally confused. Two things I put in there, one by design, one by stress. Know what I'm doing. Know what you're doing in every step. If there isn't a purpose, don't do it. Don't waste your time doing something if there's no purpose in what you're doing. And follow a particular pattern with everybody until you get down into the area where you're ready for the therapy. That's all you change is the therapy. So what you've been doing here is learning the steps, what you're looking for, and then we're ready for therapy. All right. You've got the library now, the nice books and the not so nice books, and then you tell them emotionally who they are. You see, if you say you will be, subconscious mind says, when will they be? It never gets done. You put it in the present tense. I am, and I do, and this is the way things are. This is how I feel. Because if you think you are that kind of a person, that's who you become. And I showed you this right here. I had a young lady raise her hand up. I say your hand is like, I squeeze your arm nice and easy, and it causes the arm to lock in position. But my hand along the arm, and I say do so, cause your arm muscles to go stiff and rigid. Like a steel bar wrapped in steel bands. So stiff and so rigid that you can't even bend it, can't even move it. It became that way after I said, that's how things are. If I used the word will, it would never happen. Okay? So you're going to tell the person that you are this wonderful person, this pleasant person, the lovely, compassionate, and understanding. Up to now, we've taken care of nothing but the emotions and feelings. And now we have to talk about something else. We're talking about the physical problem. So when you get through with all of that stuff in the emotions into the library, now we got to get that immune system working. And I'm going to work on that this afternoon. You'll know how it goes, and then we're all through, we will discuss it. All right? Okay, whoever has a problem up here, you bring your seats up here, and you come down and sit down. If you want to stay in your own chair, that's okay.
Michael.
But those...
This young man has a long trip ahead back to New York State and was, I'm wondering if you could do him before the group.
We're going to do them all. He's sitting right here. Come on, young man. Anybody who wants to come up, you can do the same thing in your chair back there. Sit down. Could we turn this light just a little bit away? Let me take care of it. I think I can. I know I can.
Here's the best way.
And that one. One, two, three, 4, 6, 7, 8, 9. You think it's going to work better up here than sitting right there?
No.
Okay. How do I hypnotize all these people at one time? Tell me, how do I do that? What? That's right. I don't want you in the sunlight, so you're going to have to move up a little bit. Move up and a little closer. Come on, pull together a little more. Up and a little closer. You got to go this way. The light's shining on you.
That's all right.
Slide back a little bit.
No problem. Sure.
Why don't some of you get back here? Come on, you're too close. Get back in here. Let's see if we can get some of these big ones dimmed just a little bit. There. Just turn around just a little bit. That's fine. All right. Let me get in here. For those of you who haven't been here and don't understand what we're doing, I'm going to ask you to close your eyes after a while, not right now. I'm going to ask you to concentrate and focus your attention on your eyelids and your eye muscles, and I'm going to ask you to relax them. Don't expect me to do it because I have no control over your body. I'm going to say, think about your eyelids and your eye muscles, and you relax your eyelids and eye muscles. I'm going to ask you to think about your cheeks and relax your cheeks. Think about your shoulders, relax your shoulders. And you think about your arms and relax your arms all the way down to your fingertips. I'm going to ask you to relax your whole body, top of the head, down to the fingertips, and down to the toes. You think you can handle that for me? Okay. How about you? Fine. All right. Then I'm going to have you picture and imagine a lot of little things. You're going to be hypnotized to understand this, but believe me, you'll never know it. So why don't everybody just close their eyes for a moment? Keep them closed. Everybody close them. All right. Now I'm satisfied that you heard what I did. I'm satisfied you can hear me. Would somebody else just kind of tap their hands and talk back there? Say something. You heard all that. Somebody may come in this room and you may hear the door open. Maybe next door they're going to drop a glass or two and smash something. You're going to hear it. So just understand, you're not going to be unconscious anytime during the course of the session. But I'm going to ask you to think, to picture and imagine a lot of little things. And when I say, when you had this picture in your mind, nod your head, yes, I had this picture in my mind. You nod your head, yes, you have it. But if you don't have it, don't shake your head, yes. You can shake your head, no. And no means sideways. Yes means up and down. All right? I'm going to ask you to pick up a few things in your imagination. You're going to see something, pick it up, and do something with it. And when you've done what I've asked you to do, nod your head, yes, you've done it. If you haven't done it, don't shake your head, yes, because I don't know what you're thinking about, so I'm going to ask you. So I know, because you're going to tell me what you're thinking about. So what I'm going to do is have you think about a lot of little things. Picture, imagine you're doing something. I'm going to take you on a little trip in several rooms. Have you do a few little things. Okay, do we have any questions about that?
When you say that I've done it, does that mean I have a picture of it in my mind?
If
or
I say go
actually-
pick up a book and hold it in your hands, if you have it in your hands, nod your head yes. If you can't see the book, shake your head no. You can't pick it up,
So you see it or feel it or whatever.
you're not going to see it. You're going to in your mind, you're going to picture it.
You're going to picture it.
Yeah. Is that a problem with you?
I-
Close your eyes. All right, keep them closed. Why don't you picture and imagine you're sitting someplace in your house, any place. I don't give a damn where it is. Any place.
Okay.
When you had that picture in mind, nod your head. Don't say a word to me. Nod your head, yes. Look across the room from you, and now you can tell me, what do you see across the room? What do you picture across there?
I see my window and the big tree in the backyard.
Oh, okay. What kind of window is it?
It's actually a slider. It's a big thing you can walk out of onto a little deck.
I don't know about it. You tell me about it. What is it? Is it a patio door?
Yeah.
Yeah. Okay, you slide the door and you walk outside.
No, you walk out to
You walk it through the doorway.
a little
All
deck.
right. Okay, what else do you see? Look to the left of the doorway and tell me what do you see.
To the left of the doorway is the rest of the other side of the slider.
To the left of that.
On the wall, there's a hanging piece of cloth from Africa that my daughter brought me.
What's the color of the cloth?
Oh,
Describe it.
It's bright greens and yellows and reds.
Okay, over to the right of the other door, the sliding door. What do you see?
There's another window with little, shade on it, but it's a little.
I don't know, you tell me.
Shade, Venetian shade.
What room are you in?
I'm in my bedroom.
Your bedroom. Is there a dresser there?
Yeah, but it's in the sun space.
What else you got? Is there a clock in your bedroom?
Yes.
Yeah. Why don't you get over there, walk to that clock, and pick up that clock, and hold the clock in your hands. When you have it in your hands, nod your head, yes, I have it. Put the clock back where it belongs. When it's back there, nod your head, yes, I put it back. That's fine. Open your eyes now. Something like that. That easy? Sure, okay. All right, everybody close your eyelids. Dave, you come up here. Close your eyelids and keep them closed. Don't open your eyelids until I ask you to. Even when it's necessary for you to answer my question or do something, keep your eyelids closed. Don't open them. Now I'm going to ask you to direct your attention to your eyelids and your eye muscles, and you relax those eyelids and eye muscles. You make those eyelids comfortably closed now, come on. Pleasantly closed. Bring upon a sensation, a feeling that for you is comfortable, pleasant, soothing, satisfying, and relaxing. But you have to think about your eyelids. So you direct your attention to your eyelids, and you relax those eyelids. Make your eyelids totally limp and completely relaxed. In case somebody starts to fall, go and catch them. So be aware of what you're doing now. And really let those eyes become ever so limp, comfortably closed, pleasantly closed. You see, I can't relax your eyelids. You take care of that. You may want to think to yourself, hey, I'm behind these eyelids, it's nice and dark back here, and it's soothing and comfortable and pleasant and pleasing, restful and relaxing. So I ask you to concentrate on your eyelids and really let those eyes become ever so comfortably closed. And you're going to find that each passing moment causes your eyelids to relax even progressively more. So while your eyelids continue to relax all by themselves, you direct your attention to the forehead. You think about the skin on the forehead. You make the skin nice and soft, and make the skin nice and smooth, and nice and comfortable, restful and relaxing. To assist you in it's like I reached in and got a nice handful of creamy, fluffy lotion and dropped it right on your forehead. Now you know from past experience that lotion is soothing, lotion is comfortable, even penetrates in the tiny pores in your skin. Now you think about that. And imagine this wonderful feeling, this lotion slowly begins to spread and flow across your forehead, soothing and comforting, resting and relaxing, and penetrating deep, deep in those pores in your skin, sending the feeling of comfort deep, deep inside. Think about it. Watch if everybody starts to fall down, go over and grab them. And imagine this feeling of comfort and relaxation spreads all the way across your forehead and slowly trickles from the forehead down over and across the temples and down into your cheeks. And now you think about your cheeks and you relax your cheeks. Make those cheek muscles of yours real limp and nice and loose and comfortably relaxed. You see, I know that you can relax your cheeks. You make your cheek muscles so limp and so rested. Give your cheek muscles the sensation, the feeling. They want to melt a little bit. Give them a little bit kind of a letting go, but still stuck there, kind of drooping and hanging, resting and relaxing. And each passing moment causes your cheek muscle, just like your eyelids and eye muscles, to relax even progressively more. So now while your cheek muscles continue to relax all by themselves, imagine some of this relaxation flows from your cheeks down into your jaw muscles, deep into the jaw muscles, deep into the jaw muscles. Allow this relaxation to spread over to your chin and up into your lips. And now you think about your lips and you relax your lips. You make those lips of yours nice and soft, and nice and tender and comfortable, restful and relaxing. Now you see, I know that you can relax your lips. Because when you allow your jaw muscles and your chin and your lips and your mouth muscles to relax, your lips have a tendency to part and separate pleasantly and comfortably, restful and relaxing. So go ahead and relax all those muscles, pleasantly and comfortably. You may even experience the sensation as you breathe in between those separated lips. It sends all that nice fresh air down deep, deep into your lungs, spreads into the tiny pores in your lungs, all the little channels down there, feeding your lungs and your body all that nice fresh air. And as you exhale, you blow out all that burnt oxygen, the soot, the filth. So understand, with each breath you take, your relaxation continues to go deeper and deeper and deeper. And then imagine something wonderful, something soothing, something comfortable. Flows from your forehead up across the top of the head. So imagine a sensation of relaxation, rest, slowly flows from your forehead up across the top of the head, soothing and caressing the top of the head, penetrating deep inside. Think about it. Imagine a sensation of relaxation spreads all the way across the top of the head, and that pleasant feeling of comfort, peace and quiet and dignity flows down the back of your head and the back of the neck and settles deep in the neck muscles. So I asked you to think about and to relax all these muscles. And as you do so, you might just experience that as the muscles relax, you might experience a tendency for your head to slowly fall forward. And if it does, and let your chin rest on your lap, and hey, that's perfectly okay. Just go ahead and relax as much as you can. And then imagine this relaxation, this feeling of comfort, has that tendency to become loose. And the feeling of relaxation seems to drain down from the top of the head, drain down from the forehead and the eyelids, drain down from the cheeks, drain down from the lips, down through the neck, all the way into your shoulders, and slowly spreads and flows across your shoulders, soothing and comforting, penetrating, resting, relaxing all the shoulder muscles. And now you direct your attention to the shoulders, and you think about the large and small muscles in your shoulders. Let all these muscles become totally limp and completely relaxed. Think about that. Then imagine this relaxation spreads all the way across your shoulders. Then why don't you send this relaxation down both of your arms? So now imagine something soothing, something comfortable, something very pleasant slowly flows down your arms, over the skin and deep, deep inside. Hardly flowing, about the speed that molasses might flow. You mean hardly moving, slowly trickling down, penetrating, resting, relaxing all the muscles in your arms, each and every nerve, all the fibers, even the tendons, all the cells, everything from the shoulders down to your elbows. Now you think about your arms from the elbows to the shoulders, and you let your arms become totally limp and completely relaxed. You take care of that. You relax those muscles. Then imagine this feeling of relaxation slowly continues to spread and flow past the elbows again, over the skin and deep, deep in the muscles. Slowly flowing down, soothing and caressing, penetrating, resting, relaxing, everything in this path. This relaxation flows downward, downward, all the way from the elbows down to the wrist. Now you think about your arms from the wrist to the shoulders. And come on, let your arms go totally limp, completely relaxed. But this relaxation continues to spread, flows past the wrist. Imagine something soothing flows over the back of the hands, a pleasant feeling into the palms of the hands, and all this sensation of comfort trickles and spreads to your fingertips all the way to the end. Now you think about your arms from the fingertips to the shoulders. You let your arms become totally limp and completely relaxed. Now I know you can relax your arms. I know you can relax all these muscles. So go ahead and you think about it and relax everything as much as you can. Nice and easy. Let your arms go totally limp, completely relaxed. You might even experience that your arms have a tendency to fall at your side, and if it does, that's perfectly okay. Don't worry about it. Then imagine something soothing, something comfortable, something very pleasant. Flows from your shoulders down your chest, and from the back of the shoulders down the back. Imagine the most wonderful, the most soothing, the most restful sensation, the pleasant feeling that you could ever experience, slowly flowing down, draping your body in a sensation of deep comfort and total relaxation. Shoulders down through the chest area, back of the shoulders down the back, into the lower back, and from the chest area into the stomach area. And then you send this relaxation all the way down into your hips. Let this feeling of comfort spread into your thigh muscles and past your knees, down to the ankles, into the feet, and right to your toes, and you relax your whole body. Tip of the whole toes all the way to the top of the head. Now there's a reason why I ask you to relax your body. You see, I've got to tell you, especially those of you who are here in front. You see, your body is full of human energy, so much of it. And as you allow your body to relax, this human energy is automatically relaxed and released and starts to leave the muscles, the tissues, the tendons, and the cells, and slowly floating up your body like tiny bubbles of energy, letting go from your toes. Bubbles of energy continue to bubble from your toes, bubbling up into your feet. And bubbles rise higher and higher. They do bounce against more cells, more tissues, more muscles, causing additional bubbles of energy to let go, filling your thighs full of moving, rising bubbles of energy, crowding into your hips, gathering more into the stomach area and all the way up into the chest. And from your fingertips, bubbles of energy start to let go, rising up your hand. And these two bubbles of energy, they also bounce against more cells, tissues, muscles, shaking more bubbles of energy loose, filling your arms full of moving, rising, bouncing bubbles of energy. And all these bubbles of energy converge and they meet in your shoulders. Then one by one, the bubbles take up the back of your head, top of the head, and almost like they disappear, but they don't. They just take on a whole new identity. And what I'm going to do is teach you how to redirect this energy so you can fulfill your new needs and your new desires. So understand that the more you relax, the more energy you have to work with. The more energy you have to work with, the better results you're going to get. So all you got to do is sit in that comfortable chair and just take it easy and relax. That's all you got to do. And I told you at no time during the course of this session are you going to be unconscious or unaware. So please don't expect this to happen to you. Should something happen in this room, people walk around, some noise, you'll hear everything, you'll know about everything. But you'll find that nothing bothers you, nothing disturbs you. Whatever you hear just causes you to relax deeper and deeper, feeling more pleasant, more peaceful in your whole mind and your whole body. And your thoughts may drift to another subject if that happens. Don't be concerned about that. That's a normal function of your thought process. Don't be concerned about it. You see, I just want you to understand that your subconscious mind is already open and receptive to everything that you and I talk about and all your needs and all your desires. And I'm also satisfied that you do recognize that, yes, you can relax even more than you are now. So in a moment, I'm going to have you count like this. 100, 99, 98, 97, 96. And when you start counting, especially the people up in front, you just whisper, and I mean hardly, barely whisper. So it's difficult for me to hear you. And then slowly, very, very slowly, keep right on counting. You see, each decreasing number causes you to relax progressively more and more, and with each decreasing number, you are relaxing, feeling more comfortable, more pleasant, and more peaceful your mind and body. So nice and easy, just to yourself. Whisper as low as you can, 100. And then slowly, slowly, very slowly, count backwards, 99. And keep on counting. Now while you're counting backwards, once again you direct your attention to your arms. That's all the area from your shoulders to the elbows to the wrists to the fingertips. And now you make those arms totally limp and completely relaxed. So go ahead. Make those arms limp and loose and rested and relaxed. Then relax your thigh muscles and down past your thigh muscles and past your knees all the way down to your toes. Think about your toes way down there. And you let your legs go totally limp and loose. And as you allow your arms and legs to relax, cause the numbers to lose their importance. You find the numbers fading away, disappearing, going, and gone. No longer important. Let it be. Like to have you picture and imagine that you're in a classroom, a schoolroom, any kind of a room, a classroom, one you've been in before, just an imaginary classroom. And as you stand in this imaginary classroom, this nice, wonderful classroom, look around, and you just might see the chairs that the students sit in. Might be a combination desk and chair, maybe an armchair, plain old chair. Usually the students' chairs come in rows. Most classrooms have a teacher's desk. Some classrooms have windows. And on the walls you might find some posters, maybe some pictures, possibly some bulletins, maybe some student work, maybe some decorations. And then there's this nice blackboard. So you picture and imagine that you're standing in a classroom, and as you stand in this classroom, look around. You may see the chairs that the students sit in, possibly a teacher's desk, something on the walls, and the blackboard. And though you're sitting up in front, when the picture of the blackboard is reasonably clear in your mind, nice and easy, just nod your head, yes, I can picture this blackboard. That's fine. Now I'd like to have you walk over and stand close to the blackboard, about 1.5 feet away from the blackboard, and you face the blackboard. Look at the blackboard. Standing so close to the blackboard, facing the blackboard, looking at the blackboard, chances are all you can see is the blackboard. So while you're standing facing the blackboard, looking at the blackboard, allow your eyes to drift down to the bottom of the blackboard, and there's a ledge. And on the ledge is a piece of chalk and eraser. With one hand you pick up the chalk, the other hand the eraser. Now you should be standing facing the blackboard, chalk in one hand, eraser in the other. Everything is quiet and pleasant and peaceful. When you have the chalk in one hand and the eraser in the other hand, again, just nod your head yes. I'm standing there with the chalk in one hand, eraser in the other. Just nod your head yes when you're standing there. Now, the chalk you have in one hand, slowly and very carefully, write the letter A on the blackboard. Take your time now, nice and easy, write the letter A on the blackboard. And when you have the letter A on the blackboard, with the eraser you have in one hand, slowly and carefully erase the letter A from the blackboard. Take your time, slow and easy. We're in no hurry. Now with the chalk you still have in one hand, carefully and nice and easy, draw the letter B on the blackboard. Take your time. Letter B is a pretty letter. The letter B has a lot of nice loops and some turns and some twists. When you have the letter B on the blackboard, again with the eraser, slowly and very carefully erase the letter B from the blackboard. Take your time, no hurry. And when you have the letter B erased from the blackboard again, with the chalk you still have in one hand, nice and easy, slowly and carefully, write the letter C on the blackboard. Hey, take your time, no hurry. Letter C is a simple letter. Nice and simple. When you have the letter, then with the eraser, erase the letter C. Take your time. When you have the letter C erased from the blackboard, you just stand there for a minute and take it easy. You see, in a moment, I'm going to have you continue with the rest of the alphabet. When I ask you to start, you're going to start with the letter D. But please, don't start until I ask you to. You see, I'm going to have you write the letter D slowly and carefully. Then I'm going to have you erase the letter D just as slowly and carefully as you can. Then I'm going to have you continue, slowly writing and erasing the letters of the alphabet. And each movement of the eraser causes you to relax deeper and deeper. With each movement of the eraser, you are relaxing, feeling more comfortable, more pleasant, more peaceful, your whole mind and your whole body. Now you may start with the letter D. Slowly, ever so slowly, write the letter D on the blackboard. And when you're ready, you can go ahead and erase the letter D from the blackboard. And then you continue slowly and very carefully writing and erasing the letters of the alphabet while I talk to you. You might remember when you first became acquainted with the letters of the alphabet, some letters were simple, other letters were difficult. Backwards. You might have had a problem with the D and the B, the M and the N, or the U, the V, and the W. And then when you tried to recite the alphabet, the time you got down to a certain letter in the alphabet, and you couldn't remember the next succeeding letter. And the harder you tried, the more difficult it became. So you went back to A and B and C, hoping to pick them when you couldn't remember. So go ahead and erase away all the remaining letters of the alphabet. Erase the letters away, let them fade away, disappearing, going, and gone. And you put the chalk and eraser back down on the ledge. Then look around in this classroom, and as you look around the classroom, there is a door in this classroom, and this door leads from the classroom. So look around. And when you recognize the door that leads from the classroom, just nod your head yes. I can see this door that leads from the classroom. That's fine. Now I want you to understand the door you're looking at leads to a library. And you know what a library looks like? A library's got a lot of bookshelves and bookshelves in rows. Library is quiet. Library is pleasant. Library is a good place to go and to think. So walk over to the library door, open the library door, step into the library, and look around in your library. And as you look around, you might just see the bookshelves. When you recognize the bookshelves, and the bookshelves are reasonably clear in your mind, again, just nod your head, yes, I can see the bookshelves. All right. Those of you who don't see the bookshelves, can't find the bookshelves, walk back through the library door, back into the classroom, and you go and sit down in one of the chairs in the classroom. And you stay there. Those who are going back to the classroom, nod your head, yes, I'm back in the classroom. All right? Those of you who are still in the library, in a moment I'm going to have you walk over and stand between two bookshelves. And when you stand between the two bookshelves and look down the aisle, you'll find the books on the right side of this aisle. They're pleasant books, nice books, books that have been read and books that have been used. Books on the other side are not so nice. So go ahead and you select any aisle in this library and you stand between the bookshelves and look down the aisle. And when you look down the aisle, you find the books on the right side, pleasant books, nice books. Books that have been read and books that have been used. Books on the other side, not so nice. When you're standing between the bookshelves looking down the aisle, just nod your head, yes, I'm standing there. All right. You see, now I have to tell you about these books that you see as you look down this aisle. All these books are about you. That's right. Everything that you ever did in your whole lifetime is recorded in these books as you look down the aisle. Not only everything you did, but all your thoughts and emotions and feelings. That means every thought you had in your whole lifetime is recorded in these books as you look down the aisle. And so too all your emotions and feelings, symptoms, fantasies, even your dreams, all the dreams you had in your whole lifetime are recorded in books as you look down this aisle. So as you look down the aisle, these books, they hold and record everything you did in your whole lifetime, every thought you had in your whole lifetime, all your emotions and feelings you had in your whole lifetime, and even your fantasies and your dreams. And you see on the right side, the nice books, the pleasant books. These books they hold and contain and they have recorded all the pleasant things you did in your whole lifetime, and the wonderful thoughts you had in your whole lifetime, and your good emotions and feelings, even your nice dreams. The books on the other side, they hold and contain those not so nice. The books closest to you, these books they hold and contain and have recorded your most recent experiences. That's the things you did today, yesterday, and the day before. Not only your most recent experiences, but your most recent thoughts, even your most recent feelings, also your most recent dreams. And farther down the aisle, these books are about you when you were younger and smaller. And farther down the aisle, these books they hold and contain the things that you did when you were younger and smaller, even what you thought about when you were younger and smaller, and all your emotions and feelings when you were younger and smaller. And way down on the end of the bookshelf, the books they contain the things you did when you were a baby, what you thought about when you were a baby, how you felt when you were a baby, even what you dreamt about when you were a baby. And these books have pictures. Pictures of everything that you ever done in your whole lifetime. And I'm not going to ask you about any of your pictures. So I'll tell you what you do. You look at the books on the right side, the nice books. And then slowly, very slowly, walk down the aisle. Keep your eyes on the books on the right side. Walk halfway down the aisle and stop. When you get halfway down the aisle, reach up on the right side. Take a book off the shelf, hold this book in your hands. When you have this book in your hands, just nod your head, yes, I have this book in my hands. All right. You see, this book is about you. This book has pleasant pictures of the nice thing you did when you were younger and smaller. Open this book to a picture about you doing something pleasant when you were younger and smaller. And those of you who see a picture, close the book and put the book back on the shelf. Those of you who haven't found any picture, as you open the book, turn the pages. You might just find a picture there. If you don't find the picture to turn the pages, close the book, put the book back up on a shelf. Take the next book off the shelf. Open this book to a picture about you doing something pleasant. You don't find a picture in that book, that's okay, don't worry about it. Close the book, put it back on the shelf. All right, now, still keeping your eyes on the right side, slowly and carefully walk down the aisle. 2 hands now, touch and feel the books as you go by. Walk all the way down to the end of the bookshelf and stop. Then take 1 step backward, tiny little step backward. And now reach again up on the right side and take another book off the shelf and hold this book in your hands. When you have this book in your hands, nod your head, yes, I have this book. That's fine. Open this book to a picture about you doing something pleasant when you were just a baby. If you don't see a picture, don't be concerned about it. All right, everybody just close the book and put it back up on the shelf. Now look at the books on the other side. They're not so nice. Some of these books are problem books. Understand, every problem you had in your whole lifetime has its own book. Every problem that you had in your whole lifetime has its own problem title. And in that problem book are all of your experiences as they relate to that problem. In that problem book are all of your past feelings and emotions as they relate to that particular problem. So you look around on the not-so-nice side, and there is a book up on that side that has a title, Stress. S-T-R-E-S-S. And that stressful problem book holds every past stressful experience that you ever had in your whole lifetime. Also recorded in that stressful problem book are all your past stressful emotions and feelings, even your past stressful thoughts. When you recognize your stress problem book, reach up on the shelf and take your stress problem off the shelf. And hold your stress problem in your hands. When you have the stress problem in your hands, just nod your head, yes, I have this stress problem in my hands. I want you to understand what you're really holding. You're holding in your hand every past stressful experience you had in your whole lifetime. Every past stressful thought, past stressful dreams, past stressful emotions and feelings. And some of these have a tendency to creep in today's and tomorrow's conduct, mess up today's and tomorrow's pleasures. No longer useful for you in light of today's circumstances. I tell you what you do. You look around on the floor of this aisle. There's a container you hadn't noticed before. So look around on the floor of this aisle, and when you recognize the container, you take your stress problem over to the container and you throw your stress problem into that container. Don't need it anymore. Drop the stress problem. And then go back to the not-so-nice side, the problem side. You see, you got another problem sitting up there. You got a book that has a title, Fear. That's F-E-A-R. And your fear problem book holds all of your past fearful experiences, all of your past fearful emotions and feelings, all of your past fearful thoughts, whatever they may be. We all have different perceptions, different ideas. But understand, in your book is your past fearful experiences, your past fearful thoughts, your past fearful emotions. So look around. When you recognize your fear problem book, nod your head, yes, I see that one. All right. Reach up and take your fear problem off the shelf and hold this problem in your hands. Again, I want you to understand what you're holding. You're holding your past fearful experiences, your past fearful thoughts, your past fearful emotions and feelings. And there's nothing you can do about changing your experiences of the past. And since you can't change your past experiences, past thoughts and feelings, you say, hey, why don't we just get rid of the past fearful thing? So you take your fearful problem over to that container and you chuck it. I mean literally throw your fear problem into the container. Now understand what you just threw away. Your past fearful experiences, past fearful thoughts, whatever they amount to, whether it's an elevator, an escalator, whether it's fear of failure, fear of swimming, fear of anything. Walking outside, standing in a line, being alone. Think about what you just threw away. Yours. Your past fearful experiences, past fearful thoughts. You're saying, hey, I asked him to get rid of it for me. I showed you how. You had your past experiences and you threw them away. Your past thoughts of fear and so forth. Everything. Lock, stock, and barrel, throw it away. No longer important for you in light of today's circumstances. So go back to that problem side, the not so nice side. And I'm going to ask you to look around. And what I ask you to find may not apply to each one of you. I don't know. You see, I haven't lived your life. I haven't had your thoughts. I didn't experience your emotions and feelings. But since we're dealing with a lot of different people, some of you, as you go and look around, you just may find a book, a problem book, that has a title. Maybe smell. That's S-M-E-L-L. You might just find a book that has a title, taste. That's T-A-S-T. And you may just find a book, and you might find two books even, that has the word, the title, allergy. That's A-L-L-E-R-G-Y. And then you look around, the rest of you look around. And one of you may find a book that has a title, sex. Hey, that's a problem that you had with sex. And you understand what your problem is with that sex. And you said, I got a sex problem. I want you to get rid of it for me. So those of you who see the smell, or the taste, or the allergy, or the sex problem book, take your problem off the shelf and hold this problem in your hands. Understand what you're holding. That's your problem. Your past experiences with that problem. Your past thoughts with that problem. Your past feelings and emotions with that problem. And you take your problem to that container and you, on your own, throw your problem away. Throw your problem away. Then you go back to the not so nice side and you stand there and you wait, because you see, some of you people are going to look around and you're going to find a problem up there that has the word or the title depressed. D-E-P-R-E-S-S-E-D. You got one up on there? Nod your head, yes. I see my depressed book. And those of you look around and you may find a weight book. That's W-E-I-G-H-T. That holds all of your experiences you had with a weight problem. All the thoughts you had about the weight problem. All your feelings and emotions with the weight problem. Some of you look around, you may find the smoking problem book. That's S-M-O-K-I-N-G. Hey, if you had a smoking problem, you better believe it. The problem book is sitting up there. Some of you may find a book that has a long title. The title of this book is Intolerance. That's I-N-T-O-L-E-R-A-N-C-E. what that problem book contains. All of your past experiences that for you have been somewhat intolerable. Your past feelings and emotions, symptoms and fantasies and feelings. Intolerable. Frustrations. Maybe you want to call it upsetting. If you have seen, and when you have seen some of the problem books that I have suggested, you take your problem books off the shelf, hold these problems in your hands, and understand what you're holding. You're holding your past experiences as they relate to the problem you're holding. You're holding in your hand your past feelings and emotions, symptoms, dreams. And I'm sure you have a need to dispose of your problem. So take your problem over to that container, and yes, you do the same thing. You throw your problem into the container. Drop that problem. Then go back to that problem side, the not so nice side, and you might see, for some of you, a book that has the title Arthritis. You know, I used to laugh about this arthritis. Art is always back, arthritis. And Art is not such a nice person to have around. You see, his first name is Art, his last name is Ritis, R-I-T-Z. We don't like him. Some people call him Art Ritz. But those of you who have an arthritis, it's an A-R-T-H-R-I-T-I-S. If you have an arthritic problem, oh, you bet, your book contains your past experiences with arthritis, your past feelings, emotions, and symptoms, fantasies, and dreams. Other of you look around, and you have a book up there that has a title, Teeth. That's T-E-E-T-H. You got some teeth problems, maybe some problems with the gums, which is normally part of the whole program. Look around. Somebody says, I want to get rid of my tooth problem. Hey, it's only one. Let's find all the problems in your teeth. So you take your problem books off the shelf, you carry your problems over to the container, and you throw your problems into the container. You said you don't want that problem anymore, you're holding it in your hand, drop that problem in the container. No longer important for you in light of today's circumstances. Then all of you go back to that problem side, the not so nice side. I want you to understand something, what happens in your body. Every day, certain cells in your body have been used up, and they die. They serve their purpose. They can only last a certain period of time. And when that cell passes away and you're dispose of it, you have to build another cell to replace the cell that you used up in your daily activity. So understand, each and every one of us on a daily basis has used up certain cells in our body, and then we build new cells. And we build the new cells from the nutrition that we eat. We extract the nutrition from the food that we eat, and we build new cells to replace the ones that we used up. So our body is forever changing. But you understand, you see, we aren't perfect. And we don't build every cell absolutely perfect, absolutely intelligent. Some of the cells that we build in our daily activity are confused, don't know where to go, what to do. Some of the cells that we build in our daily activity are mutated, not just right, possibly diseased, don't belong there. And these cells, when they come loose and are not destroyed, they invade other cells that are healthy and strong. And they kill that nice healthy cell and use up that cell as energy to continue to live. Eventually, they have a tendency to destroy quite a bit of cells. These cells that are mutated, diseased, confused, actually end up being cancer cells. So understand, each one of us, on our daily basis, we have within us certain cells that can become cancerous. But that's not a problem, because you see, when we were born with a backup system. And when we build a cell that's not just right, the good cells we have in our body attack these cells and destroy them. So when our immune system is strong and efficient, it takes care of it. Not for everybody, but for some people. You have a book up there that has a title, Cancer. And when you recognize your cancer problem book, just nod your head, yes, I see that problem book. You take your cancer problem off the shelf and you hold this problem in your hands. You take your problem over to that container and you throw your cancer problem into that container. You said you want to get rid of the problem, drop the problem. And what you're throwing away is your past experiences you had with cancer, your past thoughts that you had with cancer, your past feelings and emotions you had with cancer, even the past dreams you had about cancer. Then I'd like to have you go back to that not so nice side and look around. You just may find a book that has a title, IEYE. It holds all of the problems you have with your eyes, all the thoughts you had about your eye problem, emotions and feelings. Some of you look around, you might just find another problem that has a title, lung, L-U-N-G. We all may not have that up there, but those of you look around. If you had a lung problem, believe me, you've got a book up there that has a title, lung. You take your eye problem off the shelf, you take your lung problem off the shelf. Some of you may have a problem with your heart. If you had, you got a book up there, has a title, Heart. H-E-A-R-T. I'll tell you what I'd like to have you do. Look around. You see, every problem that you ever had in your whole lifetime has its own book. Every problem book has its own title. So why don't you do yourself a favor? Look around. You'll find some more problems up there. Take your problems off the shelf and you throw your problems in the container. Clean house. Take your time. Look around. I'm not going to ask you about these problems. So when you recognize a problem, take your problem off the shelf and throw your problem in the container. Clean house. Take your time. We're in no hurry. Look around. And when you have disposed of any problems you want to get rid of, just nod your head, yes, I'm done, and we can continue. Now I would like to have you do, all of you, is walk back up the aisle to the point where you first entered the aisle and look around, and there's a nice, comfortable, easy chair in your library. Just go sit down in your comfortable, easy chair in your library and relax. And just take it easy. Stretch out and relax nice and easy. Relax your legs. That's all the area from your thighs, down past your knees to the ankles, down to your feet. And relax your arms, all the muscles in your arms. That's from the shoulders down to the elbows, all the way down to the wrists and to the fingernails and the fingertips. Hey, if you like, go ahead and relax your shoulders and your chest. Why don't you relax your eyelids and your lips, your cheeks? Relax your whole body. Go ahead. Because I want you to understand what you did. You went back in time until you were just a little child. Then you went on the not-so-nice side and you recognized the problems you accumulated over the years. You took your problems off the shelf. You threw your problems into a container. I think you did a nice job. You see, I want you to understand what you did was like mind surgery. Like a doctor or a surgeon may open up the area around the stomach and take out some troublesome appendix. Take the appendix out and throw the appendix into a container. And once the appendix are in a container, they can't bother the person anymore. Or like a dentist may extract a tooth. Once a tooth has been extracted and cast aside, it can't bother the person anymore. And you took the problems that you recognized, that you experienced, that you thought about, you took your problems off the shelf and you threw your problems into a container. I think you did a pretty nice job. So I'd like to have you do one more thing. Is get out of the chair you're sitting in and walk back down to the aisle and look at the container you got sitting down there. Now in a moment, I'm going to count up to 10. And when I count to 10, it causes the container to slide and glide away from you, cause the door in your library to open up, and cause the container to go right through the doorway. 8, 9, 10. Container starts to slide and glide away from you, door opens up, and right through the doorway goes the container, carrying all the problems you decided to get rid of. And when the container and the problems are gone, the door automatically closes. And you hear the door lock good and tight. And now you go back up the aisle. You go back to that chair. You sit in that comfortable chair and relax and take it easy. You see, not only did you get rid of your problems, you threw them away and you saw them go now. Now understand, as we talked before, for some of you, as you lived your experiences and as you had your thoughts, emotions, and feelings, all of your experiences, thoughts, and feelings were recorded in the memory bank in your library of knowledge. You did this on a conscious level. And your subconscious mind has been reading your books, telling the brain what to do based upon what you put in there. Now when your subconscious mind meanders up and down that aisle and says, wow, what do you know? Somebody came down here cleaning the house. And am I pleased and am I tickled? Because I don't have to talk to the brain anymore and give these lousy messages you put in here. Isn't that nice, wonderful, pleasant, and peaceful? That's right. Now I'd like to have you picture and imagine getting out of the chair again. And you go back to the aisle. And this time you look down the aisle, the right side, bottom shelf, there's books that are wrapped up. So go ahead, go down that aisle. Eyes on the right side, bottom shelf, books that are wrapped up. And when you recognize the wrapped up books, just nod your head, yes, I see those wrapped up books. Reach down and pick up a book that's wrapped up and hold this book in your hands. You see, this book has a title. The title of the book you're holding now has a title. The title of this book is Health and Happiness. Unwrap your Health and Happiness book and put your Health and Happiness book up on the right side, the nice side, a position that's important. And then reach down again and pick up another book that's wrapped up. Hold the second book in your hands. The second book also has a title. The title of the second book is Success. Unwrap your success book and put your success book on the shelf next to the health and happiness book. You got two books up there, Health and Happiness and Success. Two very important books in your library of knowledge, your memory bank. When your success book is on a shelf, reach down again, pick up a third book that's wrapped up. Hold this book in your hands. When you have this book in your hand, just nod your head, yes, I have this one in my hands. Yeah, this book has a title too. The title of this book is Desires. Every desire you ever had in your whole lifetime, every desire for health and happiness and every desire for success is wrapped up in your health and happiness book. Whether the desire is a physical desire, a material desire, or a spiritual desire. Unwrap your